Hi, my name is Tyler Hart. I'm a second year student at UF and I'm studying computer engineering. This is my sister Naya Hart. Naya, can you tell me a little bit about yourself? What do you do? What are you studying?
Sure. Okay, so currently I'm in nursing school in St. Pete, and I work in a hospital as a nursing assistant. I work in a bunch of different categories right now: cardiology, I work in oncology, occasionally ER as well. So I do see a lot. Yeah.
Perfect. So in this interview, we're going to be talking about the disease necrotizing fasciitis. Can you tell us a little bit about this? What is it? Have you seen it? Do you know anyone that has had it?
Yeah, so necrotizing fasciitis, when I first talked to you, I was telling you this is a disease you do not want to look up on Google Images. It is a very gruesome, just something you don't want to look at, you definitely don't want to smell. And I have seen a couple occasions of this in the ER, and basically they come in and it just looks like a black blob on your foot. It almost looks like magma over a piece of land. You know, it doesn't even look recognizable to skin. It's a disease that you can find commonly in a marine ecosystem, and we'll get into that a little bit more.
Perfect, thank you. In the review of necrotizing fasciitis by doctors Ronald J. Green, Donald C. Defoe, and Thomas A. Rashvin, necrotizing fasciitis is caused by toxin-producing virulent bacteria, and though it can occur in any region of the body, the abdominal wall, perineum, and extremities are the most common sites. What are the profound effects of these places if they are left untreated? So, why are these places important to treat?
Yeah, so first you're going to see it in your extremities. So starting out with necrotizing fasciitis, it's a little microorganism from strep A, and you're going to get it by maybe having a cut and not addressing it and stepping in some sort of bacteria, or maybe it's a burn that you didn't clean. Anyways, it starts on your extremities, so maybe you touch it or it's a cut on your foot like I was saying, and then it starts to spread. But it also can reach your abdominal cavity, and once it does, that's probably when it leads into more of sepsis and it becomes a whole body blood infection, and that can be very, very fatal if not treated.
What's the function of the abdominal cavity? What does that do?
So the lining that you're talking about is just covering all of your main organs. So once it does get past that lining, it's going to get into your blood tissue, and that's the blood infection like I was saying. But if it starts to eat basically each one of them individually, it's going to attack your stomach first, then you'll see symptoms there, liver, kidney, etc.
So it really just affects everything.
Yeah, but you'll definitely see signs of it in your extremities first.
Okay, gotcha. Okay, so according to CBS News article by Bill Sullivan, people with pre-existing medical conditions like liver disease, cancer, HIV, and diabetes are more susceptible to acquiring necrotizing fasciitis. Why is this?
Well, when you have a weak immune system, you are a huge risk factor for a lot of things. And especially since this is going through the blood, it's going to affect your body a lot faster, and you're not going to be able to keep up with it. That's why it's very important to address these infections as soon as possible, and signs of infection is going to be your fever, your inflammations, redness, swelling, heat. That's when you want to get on antibiotics. You don't want to wait till it's too late with necrotizing fasciitis.
Okay, so I guess that leads to my next question. What does treatment look like for this?
So when you do indicate that you have some sort of infection, try to get on some sort of antibiotics. Maybe just something as simple as soap and water and then Neosporin. But then when it gets to the fact that you're in the hospital, it might be a little bit too late. So that's when you're going to do some sort of broad spectrum antibiotic. Then you're going to get on something like vancomycin, which covers the entire body. Usually that one's used for a lot of things like sepsis, as we were saying. But yeah, and just a lot of teaching of how to be clean, and changing your diet as well could be a big factor.
Okay, so I have a couple follow-up questions. What exactly is sepsis?
Sepsis is a major blood infection. It affects every single organ in your body, and it can be caused through, I don't want to use the word infection too much, but through any sort of pathogen, and for example, a UTI. something very, very easily and susceptible, and it covers your whole body, and it's very fatal. It's a blood infection.
Okay, that actually does answer another question I was gonna have. Like, is it something that is fatal? Like, it gets to the point, like, if left untreated, like, I know it's also fatal, but I think you mentioned something like people might lose a foot, or
if it does. So when something is necrotizing, that means your skin tissue cells are dying. So that's when it starts to look really black. At that point, doctors are most likely going to talk about cutting off that sort of appendage, leading to amputation, right? If the antibiotics aren't working, you want to get rid of the source. Is that your...
Yes.
Okay.
Yes. And can you talk about some of the natural or normal activities that lead to this? I know you mentioned the cut in the foot.
Mm-hmm.
Can that just be anywhere, or is it certain, like you mentioned, aquatics?
That it really can be anywhere, but Vibrio is like another microbe in this situation, and that's going to be more of like an aquatic, like marine ecosystem, whatever, big body water, but like walking on the beach, like I was saying.
Okay, so like any sort of body of water, is mostly like something like the beach, like still water, moving water?
Usually still water, but it can be any water. The cases that I have seen was at St. Pete Beach. Something very common. A lot of tourists go there, but it happened to be cut on a shell, and it happened to affect her, and she ended up losing a leg. It can act that
Her
fast.
whole leg?
Yeah, her whole leg.
Okay.
And as a healthy lady. She might have had, some sort of immunocompromise, but yeah, it was a very healthy lady that lost a leg. That's why this is a important disease and pathogen to catch early.
What was the time frame of that?
So the onset of this pathogen is going to be, so you initially cut it, and then you're infected, right? And then you get the swelling, the redness, then you get fever, so it's affecting your entire body, fever, chills, and then that's when you're like, okay, my body has a very big infection. Then you'll slowly start to see your skin decay, and it'll become yellow, which means it's losing that oxygen. Then it'll become black, and then will literally eat until it's at your bone, and it'll do that for your entire foot if we're talking about feet.
So like time span, is this like a week, like a month?
If you're at the point where it's affecting you and you're getting your leg cut off, I would probably say it's about 3 weeks.
About 3 weeks.
Very fast.
Okay. Thank you so much. I just wanted to summarize everything that we've talked about up. So necrotizing fasciitis is a flesh-eating bacteria caused by strep A. It needs to be treated immediately, or it can be fatal or lead to amputation, as we talked about. People with pre-existing conditions are more susceptible. It can be acquired by tasks as simple as walking barefoot on a beach, and the treatments include antibiotics or amputation or hospitalization. Thank you, Naya, so much for telling us about this.
Of course. Glad to be here.
Thank you, everybody.